Good afternoon, everyone. Welcome back to Conversations from Stritch. My name is Dave Livingston. Really excited to be with you this afternoon. I'm joined by Dr. Christopher Sent. And in a few minutes, we will introduce our guest, Dr. Nancy Ryland, who's going to help us through some COVID-related, Thanksgiving-related stuff. But I do want to start my comments today just by welcoming everybody back. I'll say it probably a couple times this afternoon, but want to wish you in advance a wonderful Thanksgiving celebration. We have 3 more days of classes. Saturday, maybe 4, but we have until Tuesday. We're excited about getting to Thanksgiving and having some time, but we're going to talk a little bit more about that with Dr. Ryland to make sure we stay safe. Then we have a couple weeks and finals. It's been a long semester, but I do want to just again thank faculty, staff, and the resilience and kind of positive attitude of our students in terms of what we've been able to accomplish. A couple quick things, because things are continuing to happen on campus in a, what I would say is a really exciting way. I was able to, and I hope many of you were, but you can certainly watch the replay of it. The choir, Jeremy Landing and the choir had their performance just a few days ago. It was an excellent concert, really amazed at the quality and very impressed by their ability to project in some sense through masks, and really the sound was excellent. So thank you to everybody involved in that, both the taping of it and the production of it, and of course the practice and the student. We're halfway through These Shining Lives, which is our theater production, started last weekend and will conclude this coming weekend. I wasn't able to go last weekend, but plan on going tomorrow night. And so for those of you that would like to see some live theater, would ask you to join that. On a little bit more of the arts, we have the senior art show in the gallery going on, and you can also view that virtually. So if you're not on campus and you want to see some of the seniors and their work, that's available. But you can also, before you leave campus on Tuesday, you can walk through the gallery and get to see those in person. And then we still are planning on having our first men's and women's basketball contest on campus here on the 27th. So just a couple weeks away from that, and that just we will maybe talk a little bit more about this after we get back from Thanksgiving. But there are no fans allowed at that contest, and so want you to know that. But also would love you to support our student athletes by watching the game online. Those will be live streamed and available for you. We had a few questions that came in. I'll address one of them, and then I'll turn it over to Dr. Sent to address a couple more, and then he'll introduce Dr. Ryland. So we did get a question, and I will say that this question has come up a decent amount of time over I could say the last 6 months. As we're receiving our education in an online format, why are we paying the same price as a year ago when I had this same class or a similar class and it was in person? And I guess what I want to say to that, it's really important that we as a university talk about the value of the education that is not connected to the delivery modality. So even before COVID, go back 3 years, we would offer the same course in an online format and in an in-person format, and people would get charged the same amount. They got to choose which format they were in, but the formats are priced the same. The only way we kind of change a tuition price is based on program, and I mean by that the kind of overall program that you're in. So a graduate program that's an MBA might be differently priced than the DNP, which might be differently priced than the Master's in Occupational Therapy. That's the way we tend to change pricing, but the undergraduate curriculum, whether offered in an online or in-person format, if you're a full block tuition student, you're paying the same price for those courses. So I hope that addressed the question that was sent in. I know for some people that isn't satisfying, But I will say that we really believe in the quality of the education that our faculty are delivering and the experiences both in that kind of traditional classroom setting, but also in all the different ways that we create, and we're incredibly proud of this, the kind of more experiential learning. So again, flying planes, being in a clinical lab, doing your student teaching, these are all great ways for students to learn, and we price those for the quality of the education that we're delivering at Lewis. The other thing I would just want to say about that is that we have really tried hard to use, and I'll just make another plug for this, is to use the COVID-19 Relief Fund. We've had some great donors that have stepped up and created this as a possibility. The applications for that for spring semester are available. So you can go onto our website, you can click on the COVID-19 Relief Fund, you can fill out the application. If you or someone in your family has lost a job due to COVID, and we're trying to create grants for people directly connected to the loss of income due to COVID. So with that, I will turn it over to Dr. Sint. There's a couple other questions that he's going to address, and then we're going to have a conversation with Dr. Nanci Ryland, and we're really grateful she's joining us.
Thank you very much. Great to be here with everyone today. And first I want to, before I forget, I want to second the comment about all of the amazing events that we've had this whole semester, and it's really come to it's just a great illustration of it this week with the concert, with some great visitors on campus, or virtually on campus, and giving lectures, as well as these Shining Lives. I'm really looking forward to seeing that. And again, thanks so much to our production team, our faculty and student production team that are making such high quality live virtual performances available for our community, and recording many of them as well. So please take advantage of those and try to see our theater production live during the time of production. It's very exciting. I guess, first of all, I want to say I'll do my usual email to the community this afternoon. It is chock full of, as efficiently written as possible, information about student support, about academic support, more student life activities over the next few weeks as we move past Thanksgiving. So please check that out. There's information also. President Livingston mentioned the COVID-19 Relief Fund application, but there's also a reminder about technology support applications as well, going into the break and into the spring semester. So please check all that out. And there'll be a couple other things in the email related to what we're going to talk with Dr. Ryland about, so I'll hold off on those. The couple questions came in, one related to the spring semester and our grading policy. People may recall that in the spring of 2019, when we went almost entirely online at the very beginning of the COVID crisis, we switched to a pass-fail option as a option for almost all of our classes, and students could petition to go pass-fail, and that continued through the summer. We didn't do that in the fall for this semester, and we don't plan on doing it in the spring as well. There's a pretty significant difference between what happened in the spring and what has continued through the fall and the semester, in the spring and next spring, just in terms of our ability to be able to know in advance for a whole semester what the teaching plan is or what the teaching modality is. And I just again urge students to work with professors very early in the semester to communicate about how you're doing in the class and about what options you have if you are struggling. And I think I recall that in our survey work there was a very positive response from students about how well professors were communicating with students, so that's important. I do want to say, because I don't think this is always clear, that pass-fail is an option in every semester, and there is a deadline for that the registrar posts each semester. There are a lot of limitations on it in terms of you can't take classes in majors for pass-fail, for example, or key general education requirements, but there's also a petition process for students to petition to take a class pass-fail. as long as they meet the deadline. So please talk to the registrar, talk to your faculty about making sure you know what all the options are in the pass-fail process. The other question that we had to do with the COVID-19 tracking website, or the next question I want to address. And there was a great question from a student just about how to interpret or how that kind of website works. So we might want to look at it if the team is able to put it up. If not, that's okay. But there really are, I think, at least two questions that we got related to this. One has to do with how after we post numbers, like we can see that this is Tuesday's number on the top, 16 positive cases in our community. And maybe I'll just back up and say that the cases that we post for students and for faculty and staff there, in that case 16 and 4, are members of our community who've been on campus in the past 2 weeks, who have also had a positive COVID-19 test. It doesn't have to do with where they, how they got COVID-19 or anything like that, but we know that they've been on campus either in a class, or they live in the residence halls, or they came to their office for, to pick up a book or something like that. It doesn't matter. We post it on the website as one of these numbers. That number is posted every Tuesday and Friday, and at midnight so this is actually tonight, for Friday, we poll that number, and every positive case we know about between Tuesday and Friday will be on tomorrow's website update. The problem that the student pointed out is that sometimes we don't know about a positive test. Like, let's just use the example of today. There's a certain number of positive tests today that will definitely be in tomorrow's update, but we may find, and Professor Ryland can explain this better than I can, but sometimes we might find out tomorrow or Saturday a student may report a positive test through the app, which we encourage everyone to do no matter when it is. And so that positive test actually might be dated for today, which means we found out about a positive test after we posted the number on the website. So what we do, and we're trying to be as clear and transparent as possible, we do go back and add, if that happens, we do add to the previous weeks. And it's usually only a period of 4 or 5 days. It doesn't, we don't alter the numbers or don't update the numbers weeks ago or anything like that. They stay solid, but there usually is a little bit of a learning process that takes place over 3 or 4 days as we're getting more information in and confirming that students have positive tests. So we want to get people information as quickly as possible by updating it 2 days a week, but we don't always know exactly the exact total number every single time. So we just go back and add those, and then we also summarize them by week in the historical part as well. So I hope that helps.
So could I ask a follow-up question
Yeah.
to that? Just I think, because just kind of be able to, walk through this, help people think about it, because I think the way you explained it was great. And, maybe the implied question underneath it is, are you trying to hide some positive cases for us? Because it seems like I see this big number on
Right.
Tuesday, and then I look at the next week and I feel like, but it went up by 4.
Right.
And what you're saying is, we're just trying to give you the information we have the day of. It comes directly off of our spreadsheet. It's what we know that day. But to your point, we might find things in, 2 days later, and the test date was Thursday, and that means it's going to show up in the previous week's numbers, even though we're now into Sunday or Monday of the next week. And I think that's, I mean, to just let you then introduce, Dr. Ryland. You, Dr. Ryland, all of our health professionals on campus, the people at Will County, the people on our quarantine team, contact tracing team, I just have been so impressed by the work that they've done over the last 4 months to give us data that we can act on, and we've done that. And you announced some of that a couple weeks ago, where we changed some of our behaviors because of the data that we had. And so, thank you for being transparent with the data, for keeping it updated and keeping the community updated. And we're not trying to hide anything. In fact, we're trying to be as transparent as we possibly can.
Yeah, that's right. And we're trying to be as thorough as possible and as quick as possible with sharing information with the community. And those two things are not always working in unison. So the other question had to do with the other numbers that are on that website tracker, which is how we calculate the percentages of students in quarantine and isolation. So first of all, that number is only in relationship to residential students. If you could go up, it might be easy. Well, we can see it there, but the other numbers might be easier to see. So for this week on Tuesday, we reported a percentage of students in quarantine being 4.0 and students in isolation being 1.5%. So those numbers are, first of all, only apply to residential students. We track the students who are commuter students and employees and as well, but we don't post it on this website. Those numbers are calculated based on the number of students living in the residence halls, divided, or the number of students in quarantine divided by the number of students living in the residence halls. So I'll just give an example. It seems to me, looking at things right before coming over here today, that the number of students in quarantine tomorrow will be about 5%. The number of students in isolation will be about 1%, like 1.0 or 1.1. We have about, I'm doing English professor math here, we have about 1,000, we actually have 940 or something students but living in the residence halls, but let's just say we have 1,000 students living in the residence halls. So if the number is 5% tomorrow, it means we have about 50 students in quarantine in the residence halls. 50 is 5% of 1,000. And 1% means we have about 10 students in isolation. So the numbers on the right, those percentages relate to the number of students living in the residence halls, whereas the two numbers on the left, the 16 and the 4, relate to our entire campus community of all of our students and all of our employees, faculty and staff. So they don't really have anything to do with each other directly, or one is right. They're just indicators that we think are really important to get a little bit of a sense of the impact of COVID-19 on our community and some of the things that we're watching. We are watching many other things. We'll probably revise and update the tracker going into the spring semester and maybe add a few dimensions to it, because we are definitely keeping track of a lot more information than what's coming up on there. Those are just the ones we kind of chose to highlight for our community.
And maybe you and Nancy will talk about this in a second, but one of the positive things about those numbers that we just saw is that those numbers are moving in a positive direction if we compare them to 3 weeks ago or 2 weeks ago.
They are.
Where our quarantine number would have been a higher percentage and our isolation number was a higher percentage. So just, I think it's great that our community has responded well. We've dealt with, I guess as I read it, maybe three spikes, one that was a little smaller, but one at the beginning of the semester and one at maybe week 9 or something like that. And then those spikes came and we addressed it and we quarantined a lot of people and then it went down and now we've kind of leveled out at, we'd like to have all those be zeros, and we had a few weeks in the middle of the semester where they were, but they are down, which is, I think, very positive.
Yes, so I think that's everything I think that's all the questions that came in before we started. So I'd love to introduce Dr. Nancy Ryland back to come back with us and speak with us again. Associate Professor of Nursing and the leader of our contact tracing team and a vital member of our COVID-19 hotline team. So welcome, Dr. Ryland.
Thank you so much for being here, Nancy.
Thank you for having me back.
So we did save a couple of questions that came in to ask you or to talk about with you, but first we want to lead with what we advertised, which is that we are all hearing a lot of information in the news, mostly as a result of CDC guidelines around Thanksgiving or advice around Thanksgiving and travel and all of those types of things. So we just thought we'd ask you to give us, our members of our community, advice about how to think about Thanksgiving and how to approach it, or what your wisdom is about that.
Sure. I guess maybe thinking about Thanksgiving the way our moms, grandmas, anybody that's in charge of preparing for Thanksgiving, they think about what they need to do, what they need to to buy, prepare beforehand. And that's how we all need to look at how we're going to celebrate all the holidays that are coming up, or our weekends, or whatever it might be. We really need to plan if we are going to have an event that might bring in some people outside our normal family circle. And that might include things like quarantining, self-quarantine before at least a week, if not 2 weeks before that event, meaning you take yourself out of, any type of a gathering or events where you may not be wearing your mask, such as eating out. You can't really do that much anymore. So a lot of this is kind of restricting us from a governmental level, but it really is trying to keep us out of those situations where transmission might be more prone. So things like I said, keeping yourself safe. If everybody in Lewis has been great about social distancing and masking, but for maybe those that are getting a little tired of it, this is not the time to let down your guard. This is the time to up it and make sure you're even going to the drive-through to pick up your food. Put your mask on when you're interacting with the drive-through person or picking up your food. So just going that little extra mile to help protect yourself so that you're not bringing unwelcome guests to your party. The keeping, again, the circles small. So the less different families that intermingle, the better. If you are having different groups coming together, small groups, let's your cousins or that, trying to keep that family unit, on one side of the living room. If you can have it outside, maybe we'll be blessed with a 70-degree Thanksgiving this year. Some people are turning their garages into dining room space. Keeping windows open as possible, as much ventilation, just really restricting the amount of time that you are up close to somebody. Always wearing masks as much as possible. I know it's difficult with a Thanksgiving feast, so the dining room table might need to look a little bit different, because that would be the time where you're eating, you're talking, you have your mask off, and if you're doing that for more than a few minutes at a time, there could be that risk of somebody transmitting the virus. And likely they don't know they have it. They're asymptomatic. They don't have symptoms. But we do know that people can transmit the virus about 48 hours before they start showing symptoms.
So Nancy, could I just, I guess just a little follow-up on this, because it feels like you mentioned a lot of this, but do you have any advice around, you talked about this, like the table might look different. Are there any things that you would recommend around, I don't know, I'm thinking in my head about how, this awkwardness that people sometimes talk about kind of double dipping with the same chip or something like that. But what is it, like how many utensils in terms of serving my favorite stuffing or green bean casserole, do you have any recommendations about how that should be done? Should we pre-plate for people? Are there any of those kind of things that make it safer or less safe?
Yeah, probably the passing of the platter, which is a great Thanksgiving tradition, right? Passing the turkey, grabbing your leg off of there. That's probably something that should be find a new tradition this year. So having one person potentially plating the food, or doing a buffet where individuals have their own utensil that they're taking the items for. They're coming up one at a time and sitting down. Those are some ways that you can be creative to limit the spread. For the most part, the thought process is still that the majority of transmission occurs with respiratory droplets. So, talking, coughing, sneezing. So wearing the mask is key. If somebody, and this would be, a big thing to remember, if somebody is having symptoms, and it's hard this time of the year because people wake up and they're a little congested because of the change in temperature, but really siding on, caution that if you are not feeling quite well, set up a Skype or a Zoom, FaceTime, whatever it might be, and join the group that way. It's not worth putting somebody in jeopardy, especially if you have older relatives, that may have more complications from getting the infection.
Yeah, so I want to ask a question then myself, and then it's kind of a follow-up from somebody else. So it just, I guess, two things. It sounds to me like two recommendations that I'm taking from this would be that if people go serve themselves as opposed to passing the plate around, that they should all wear their mask when they go serve themselves, right? And then
Yes.
when they start eating, they can take their mask off. But as you're walking around that island and getting your stuff, everybody should have a mask on. And secondly, maybe this sense of, I know we all want to be environmental and sustainable, but this is a day where let's not worry about your heating bill. Let's not worry about, heating the world, but maybe open up some windows and have that open while everybody's eating, because the more circulation you get, even if, maybe turn on the fireplace and open up the windows, which seems contradictory, but maybe one day a year we can do that. Does that sound right?
Right. So it's, thinking outside the box. Maybe even simple things like we're so used to, and maybe some people it's like, oh gosh, this might be a good thing. When we have get-togethers, we tend to spread them out throughout the whole day, right? 6, 7, 8 hours together. Maybe the quality of the time is more important this year than the quantity. So having that, eat dinner, maybe send people home with their dessert, and again, meet up by Zoom or, check in with them later. But just trying to limit the amount of time. And if there is the opportunity to be outside, to move around, again, keeping like groups together, especially if they're going to be closer than 6 feet apart. You'd rather them be in the same family than mixing families where you might be then sharing the virus and somebody else is then sharing it with their family.
Yeah, so I have a couple questions that have come in. So one from a parent who asks, if you had to choose between these things, and you've addressed some of this, but is it the number of people, the length of time, or being inside or outside that is the greatest vulnerability? So, kind of like, and I know you may not be able to answer that, but is it better to have 20 people for an hour versus 6 people for 4 hours? I mean, they're just trying to figure out, it sounds to me like, how do they pick the right sweet spot of these different things that maybe create vulnerabilities?
Well, since we know that the individual, the people, are the host for this virus, I would say it would be the number of people, because the more people you bring in, the more you increase your odds that you're also bringing the virus in with them. So if you have 2 people that are spending all day together, that's very limited. If you have 10 people, and even if they're spending only 2 hours together, that's a much higher percentage that one of them may have the virus. And even with that 2-hour time period, the potentially can be infecting all other 9 of those people, who then can spread it to however many people they see in the next week or so.
Yeah, so
I would say the number of people is the greatest, and then a combination of the amount of time and what other environmental changes that you can make.
Yeah, and another question that just came in from a student, which I think is a great question, because I know you and Chris and the whole team has talked about this so many times. So if everybody that's coming, student asks, if everyone in the coming gets a test before Thanksgiving, are you okay? Are you totally okay? And I know the answer to this, but I want to hear you say it.
Yeah, I answered this question quite a bit today while we were testing on campus, because it's great that our students are coming and they're being proactive, and they're trying to protect their families by getting tested, and that's great, but that's only one part of the equation. And so I explained to them that the test they get, let's say they got today, is really going to reflect what happened or what exposures they had about 5 to 12 days ago. So if they were infected during that time, they're likely to show up positive from this test. But then, of course, this test, we're not finding the results for several days. If you're getting a PCR test, which is really the preferred type of testing, but it does take a little bit longer. So one strategy to go with that would be to test, to self-isolate yourself or self-quarantine, so keeping yourself out of any other riskier activities, wearing your mask wherever you go, even if you're in the dorm, wearing it when you're around your suite mates, really limiting your risk. That then will give you a little bit of a safeguard that whatever happened just before the test and by the time you go home, your exposure risk is less. But it is not, it shouldn't be looked at as a green card, a pass card. It's just from that day and not even what happened the day or two before, because to become infective, it usually takes some cases it's 2 days, but for the most part, it's 4, 5, 6, 7 days before you would actually test positive. So that is why we encourage anybody that has known to be by somebody that's positive not to run out and get tested immediately, to wait a good 4 or 5 days before they get that test.
And then kind of a related question, Nancy, is so today is 1 week before Thanksgiving. How beneficial would it be for students who are going home to self-quarantine or some version of that starting today if they haven't been doing it already, and just taking the test out of that equation?
That's a very good strategy. It's because we know our testing isn't foolproof either, so there is a chance of getting a false negative. So just by eliminating as much risk as possible, that's the best way to protect yourself. Again, knowing that it likely would take 4 or 5 days before you would start showing any symptoms, if you did. Many, especially younger people, tend to have very mild symptoms that they don't even realize may be COVID, so they may kind of dismiss them. So by having that buffer of that quarantine time, that it would allow any symptoms to show up. The important part, though, there would be to act on those symptoms, I guess. If you have something that is not your usual, headache or stuffy nose in the morning that goes away, or you're taking your allergy medicine and it clears up, those, you have to make some hard decisions. You have to, again, side on caution and maybe change your plans. Maybe it's not traveling home the way you thought it was. Maybe it's not going to your aunt's house for dinner that night. And hopefully this is a time of Thanksgiving, so we're appreciative of being healthy and coming into the Thanksgiving season. But if there's that chance that you might bring that on to somebody else, that's something we want to avoid.
Thank you.
Yeah, Nancy, could I just ask, I think I know the answer to this. In fact, I think I'm quite confident, but it's something that has been like baked in the oven at 400 degrees for 35 minutes. The virus is going to be dead in that kind of environment. Yes? Yes,
and it's not a gastrointestinal virus, so there's no actually, it could cause some gastrointestinal issues, but really it needs to come in through the respiratory tract. So there was even something, out today in research, just really reiterating, yes, it's very important for us, to be clean, hand hygiene especially, but the hand hygiene is mainly because we don't want to be introducing the virus from our hands to our mouth or our nose. Right. The spread on surfaces is thought to be, or food or other things is probably less likely unless someone's actively coughing.
Right. So the big thing is this masking. I mean, I think we can't emphasize enough face coverings and what a crucial role they play in this.
Yes.
washing your hands is important, but the wearing the mask as much as you can is probably going to be the most valuable way. And then that notion of watching your own symptoms and staying away from people if you have any questions about the possibility that you might be sick.
Right.
I have a couple more questions that just came in. One question is this student asked, same thing for Christmas? I mean, should we just assume that, and let me just add to that, he or she didn't ask this, but a birthday party, a baptism, these same kind of rules apply for Thanksgiving, Christmas, and any other kind of family gathering that one's involved in.
Right. Normal weekend events. If it's really important for you to meet up with a group of friends, really protecting yourself and being nosy and finding out what your friends are doing too, because their behaviors are going to impact the safety of your group getting together. So this is the time to kind of ask people, have you been wearing your mask? Have you been doing a lot of traveling, or what kind of work they do outside the home that might put them at increased risk?
Yeah.
Some students have also asked that, or they know they're going to be flying home for Thanksgiving, or for going home for the semester, and that is really important to consider that as a gathering of a lot of people you don't know. That it would be even more difficult to contact trace and let them know that they may have been exposed. The good thing is air travel seems to be air travel is pretty regulated, and there's a lot of safety precautions, and they have found that the use of masks on flights really does cut down on spread within an airplane. So if you have a short flight, I encourage you not to eat or drink while you're on the flight if you can. That anytime you limit taking down your mask is going to increase your safety.
Thank you. So is it okay if we move on from
Yes, please.
holidays? Okay. So thank you so much, Nancy. And it's great that people are interested in this topic and writing in questions. I'm just going to shift gears a tiny bit. So you mentioned testing a couple of times. I guess I'll say, first of all, just as an announcement, Nancy has been our main contact with the county and the state in relationship to testing on campus. We have been doing testing 2 days a week for quite a long time now, as we've announced several times, on Tuesdays and Thursdays. Starting next Tuesday, we will do only Tuesdays on campus through December. Correct me if I'm getting this wrong, Nancy.
That's right.
And those are free tests open to the community. We usually have some internal community tests set aside, but it's part of our service to Will County or to the state. We've been doing similar testing through the Illinois Department of Public Health on weekends. I think we've done it 3 times now over the last 6 weeks, and that may or may not continue in a more irregular way through December. So that's just a backdrop. First of all, thank you for being for managing all that and negotiating it all with the county and the state. That's part of the testing we've been doing. We've also, through athletics, because of NCAA regulations in relationship to practicing and competing, been doing PCR testing of athletes in a more surveillance way. And so that's all backdrop to say we have one question about sort of why does it take, how long it takes to get a result. And I know that each of those 3 different examples I just gave have different time lags, and it really depends. Well, I'll let you answer the question. I won't answer the question. So just talk a little bit about.
Well, that was pretty much it in a nut.
Yeah.
Yeah, it's the different entities. The county and the state are using state-run labs. So there's the transfer of the specimens to that site. The testing then that has to go on. It just happened October, November. Our testing dates fell right before federal or governmental holidays, so that threw things off a little bit for our county testing, especially our Thursdays. The county buildings are not open on Sunday, so the test may come in on Sunday. If we don't have a holiday on Monday, those are then uploaded on Monday, so that's when they usually become available. So the volume of testing, as you see when we see how many people have been, tested and how many cases, and we have to have testing to find out our cases, has been exponential. So the volume into all these labs has increased. So we're seeing numbers similar to what we saw in the more in the summer when testing was sites were limited and the lab access or availability for testing was limited. It was taking 5 to 7 days, which we all said that was way too long. Things got revved up. We we're getting to the point it was getting down to 3, maybe 4 days. But then now this sudden upsurge in testing and cases has put a little bit of a damper on it. So we're hoping it gets back to that 3 or 4 day. Again, that is for the PCR test, which is the gold standard of testing. It's more sensitive. It tends to pick up positives earlier. So when people are asymptomatic and not having symptoms, whereas the rapid tests are really good because you get your result right away. They have a lesser specificity, and if you are early in the infection, may not result in a positive when, if you did it 2 days later, you would be positive. So many times if you have symptoms and you test negative with a rapid, they will encourage you to get a PCR test as a confirmation. So athletics is able to do a little bit of rapid testing now. We're, seeing how that will work as part of the surveillance. And there may be opportunities in the spring for us to do some of that more widespread on campus. But it's an ever-evolving situation, as is the vaccination, which is exciting to think about.
Okay, well, you brought it up, vaccinations. So, tell us to the extent possible what you've heard and, what you're hearing from the county and how Lewis is connected in the planning.
Yeah, it is, I think I mentioned the last time I was on just a little squirt of, information because we were starting to be involved with the county planning for vaccination distribution. And again, it's a great partnership. It's a community based entities that are bringing their knowledge and their strength and their resources together to see how to best work within the emergency planning. So counties have long had a pharmaceutical distribution plan that has been in place for a number of years, and mainly it was put together to quickly act in if there was a bioterrorist attack. We needed to get medications out to people. It was practiced when we had the H1N1 outbreak. That was 10, 12 years ago. So that same system was used, and that would be similar to what is going to be, enacted, maybe just a little bit different because of the needs of the vaccination. And Lewis is on board. We've been asked to be a partner, and we're really feel that's part of our, our mission and our service, and to be engaged in our community. So we're working on it, and probably will be early spring sometime that we'll be having vaccinations on campus.
Great, and then maybe could you reflect a little bit on what you've heard around the tier priorities in terms of different populations who would be getting the vaccine once it's available? Right.
So probably, maybe even before the first of the year and into the early part of January, starting in January, will be the first limited supply, and that will go to first responders, hospitals, probably in there, maybe the assisted livings and some of the congregate care settings that have been so tragically hit with a number of casualties due to COVID. So that would be staff and residents of those facilities. then it would likely open up to maybe at the same time, I believe we'd probably fall under a vulnerable population related to our residential students. And so community housing, that would also include, maybe senior citizens, those with chronic conditions. And then as those supplies and those, the numbers that are, being vaccinated in those areas kind of dwindle, then it would open up to the public. And so most thought is that would likely be very late spring, probably more into the summer. But the key is we need to, be straightforward and answer questions that people have. There's vaccine hesitancy about a lot of different vaccines, and this is probably going to be compounded because of it's new. It came up, about rather quickly, but we have to look at the pharmaceutical companies that have developed them are well respected, have done a lot of research. Clinical trials have been going on. I know we often, we hear on the news because it's often sensationalized. They had to stop this trial because there was a adverse effect, but that's actually good. That means the clinical trial is doing what it's supposed to do. It's watching for any type of unknown effect. It's then looking at it. What was the probability that was caused by the vaccine or something else? All those trials have gone back into completion or continuing on. So those adverse effects were addressed and, not thought to be, warranting stopping the production of that vaccine. So we should be, I guess, encouraged by those, not increasing our weariness about that.
Yeah, it's very exciting news. I have to say, maybe just to say to our community, I am so thrilled at the possibility that, these people who have been working incredibly hard, as so many of us have, but that we have multiple vaccine possibilities. Last I heard there are 3 really strong candidates that have all had positive results so far. And I think it's a testament to, healthcare professionals and scientists, which we spend some of our time here at Lewis University training, educating, advocating for people to receive degrees in biology and the sciences, et cetera. It's really great. Nancy, I know you just fixed your lighting, but
Turn the light on.
Great. So
I forget it gets
anyway,
so dark so soon.
It gets dark early now, yeah.
But you've been involved in this, but it's just exciting to me to think of the many people who have been involved in creating these vaccines. Everybody from the initial level scientists to those that have worked on the actual vaccinations, the people who have given them, people in your profession of public health who have done these trials. And, I just think we should be grateful for the way in which we have proceeded. And now we're 6 months away maybe from having multiple vaccines that can really help stop this spread and really save lives, which is thrilling to me.
Yeah. Yes, it is. And yeah.
I was just going to say we're thinking about our own community and our ability for our residential students, especially initially, as you said, to be able to have access. But I also, listening to the president, I'm thinking about all of our people in our community, our nurses, our nursing faculty, our student nurses, and our other first responders in our community being able to get access to this vaccine, within a month or is what we're talking about now, is so exciting and so rewarding to think about. So that's great news. So I guess, have any other questions come in?
No. So we have,
okay, great. So maybe
no.
one, just quick comment, and Nancy, you can reflect on this a little bit or clarify this a little bit, but we are, as and we will talk about, when we come back in 2 weeks for the next show after post-Thanksgiving, we'll have a real focus on the beginning of the spring semester and move in and any other announcements that we need to make in relationship to adjustments related to how the spread of COVID is going in the community. But one thing we know pretty for sure that we'll announce soon in writing would be that we are likely to require testing and testing in relationship to quarantine as people are coming back onto campus in January. And I don't know if you want to explain that at all, Nancy, or if we want to put that off for future explanation. But I know you've been critical in designing that plan.
Yeah, and it really came from, I guess, lessons learned through our last few months. We chose not to do that at the beginning of this semester for various reasons. Testing wasn't widely available. There was a lot of questions about the effectiveness of doing that one-stop testing. But what we have been finding, now that we have more community transmission and more individuals may have been infected and don't know it, and knowing that a positive result can linger, so the individual isn't infectious anymore after the 10 days. But if they got tested again in the next month, 2 months, even up to 3 months, they may still test positive. And so anytime we get a positive result, we have to treat it like a case. So that person has to isolate. We have to contact trace. So that information is just one of the reasons for doing this testing, is that there probably is an increased risk that people might have become infected from November, December into January, and it would be less impactful or disruptive to their course of study and coming back to campus if they knew that earlier on, so that they get that positive result. Again, they may not be infectious, but they take that 10 days of isolation. They've hopefully limited their contact with others, and then when they come back to campus, we don't have to be surprised if they would already have a documented positive, which again, the CDC recommendations is if you have a positive, not to test for about 3 months after, unless, of course, something was warranted and would need a doctor's follow-up and further testing.
So we will come back to this multiple times, but
Yes.
I just wanted to say out loud that what we're planning on then, and again, we'll say it again in a couple weeks and say it again in early January. But what I'm hearing you saying is in order for residential students to come back to campus, they will either have to have a negative test or have had a positive test and be 10 days after that. That is that they isolated, and that it would have occurred in the last 3 months. To just kind of summarize what you were saying, and again, we'll unpack this and we'll make sure we answer all sorts of questions about it. But the plan as we stand right now is that people will get a lot more information. Our residential students will get more information about this, but there is a plan for testing all residential students before they return to campus. And then there'll be some recommendations around other populations. We have 7,000 people in our community. We will give recommendations for different members of those community to test or quarantine or do other things, and that'll all be forthcoming.
And I'll just add that one of the benefits of having the spring semester start on January 17th and not earlier is that we have a little space there. A lot of what Nancy described can be done at home, but if it can't be done at home, we have space to quarantine on campus. We have testing here and so on. So there'll be lots of options about how to smoothly and delicately transition back into the campus life. So I'm done. I think I'm done with all my questions.
We can say another really deep sense of gratitude for all the work you've done, Nancy, your entire team, the whole response team, the COVID response team across multiple areas of this campus. But thank you for your leadership, Nancy. You've really and I want to remind people, if they don't know this, and maybe all people that aren't academics, it doesn't mean as much, but Nancy was supposed to be on her sabbatical this semester, and she has worked 80-hour weeks every week while she should have been doing her research and on sabbatical. So I cannot thank you enough. You're an amazing woman, and just such a leader. So thank you for all that.
Thank you so much for the kind words. I'm getting a little bit of research done.
I know. And so, Chris, do you have any last comments?
Well, this is our last show before Thanksgiving, and we'll be back in 2 weeks. So I just want to make sure I again express incredible gratitude to our entire community, students, faculty, staff who've put so much work into this semester and been so adaptable and had such resilience over the course of the time. I know that I'm the one who keeps reminding everyone that the semester is not coming to a close, but we are going through a transition, and I hope there's just a tiny bit of rest in the long Thanksgiving weekend so people can gear up and transition to have a great end of the semester. And we will be back in 2 weeks, which is still during this semester.
Yes. That's great. And so I'll just, say, I don't need to repeat what Chris just said, but I'll echo it and just say to all of you, thank you. We are very fortunate to be a part of this Lewis community. We are grateful for all the great work you've done. And we want to wish you a really wonderful Thanksgiving with all the caveats that Dr. Ryland shared with us and all the cautions. We really hope that you can spend some time with those that you love and to, recognize around your table the many blessings that we have as a community and in your own personal families. We hope you can celebrate with those that you love, either virtually or in person, that you enjoy the meal, that you break bread together, and that you are grateful to the God who blesses all of us, even in these times of crisis, for all that we've received. So many blessings to you and your family, and have a wonderful Thanksgiving, and we'll see you in a couple weeks.